So welcome to this course about the use of 3D modeling in human anatomy. The first point is why 3D modeling in anatomy? This is due to the fact that there is a lack of cadavers for the students to learn anatomy, so it's overcoming the lack of cadavers for dissection. It's coming before and to prepare cadaver dissection, but not instead. And as you know, there is also a new educational, a lot of new techniques, including virtual reality, very powerful techniques. It's possible also to make statistical analysis. And finally, which is the most important point, it's a revolution in surgery, really. Not only in anatomy, because we can make a planning, training, simulation, and augmented reality surgery. That is the future of surgery. So the outline of this course is a few words about virtual reality first, and some words also about our educational project with the UNESCO Chair of Digital Anatomy. And then we see what are the principles of 3D modeling. You see 2 points, 2 types, volume rendering and vectorial modeling. And finally, we go to the objectives and the results of these techniques. First of all, what is virtual reality? The purpose of virtual reality is to enable people to live an immersion experience. It is a cognitive activity in a digital world, digital created world. And the most important point is that emotionally, it's an impact, it's a huge impact and a huge power on the learning process. Immersion and virtual reality immersion is probably the future for learning and teaching anatomy and also for surgery, because you can manipulate real tools and connect them to the virtual operating field, that is to train. And this is going to virtual reality techniques. Some words about our educational project with the UNESCO Chair, which was founded 4 years ago. First of all, we had since about 20 years at Paris Descartes University, we had a lot of students learning digital anatomy, making Master 1, Master 2, a lot of works, thesis. The UNESCO Chair was founded in 2015 with Professor Vincent Delmas, and the aim is to spread the use of these new digital tools, particularly virtual reality techniques. And the second point is to develop partnerships between universities in anatomy worldwide to set up an anatomical data bank and a lot of models. As you can see here, a lot of partners are with us in the UNESCO, from Argentina, from Santo Domingo, from Indonesia, from Africa, from Maghreb and Portugal. So what are the objectives? It is mainly the use of virtual reality together with digital learning. This is producing revolutionary educational tools. We do courses in digital anatomy and e-learning, and we have an e-learning platform on our website. As you can see the website written here. For us, 2 types of projects are important. The first is research, mainly for 3D modeling in embryology, for shape analysis and quantitative morphology. But of course, the most important aim is education. And using these digital tools, mainly the virtual dissection table, you know probably also 3D printing, virtual immersive reality, and MORPH. What are the principles and the technique of the 3D modeling? First, what is the origin of the data? The data are first digital from the radiologists, CT and MRI, and non-digital, this is the use of anatomical slices coming mainly from visible human project. So, origin of data, radiological could be angio-CT. It's mainly CT scan more than MRI. For the anatomical, it's coming from the slices. You know the three visible human projects. And lastly, it could also use histological sections. This is mainly for embryology projects. Important points, there are two types of modeling. The first type is a volume rendering technique, VRT. This is in digital data. And for this, we perform an automatic computation of voxels by thresholding. The second type of modeling is a 3D vectorial modeling, and this is not from digital data, but from anatomical slices. And for this, we have to do a manual segmentation. Let's go to the first topic, which is a 3D modeling by volume rendering, coming from CT scan. Some words about the concept of CT scan. You know that it is a digital coding of the radiological images. The slices are produced in DICOM format, and this is displaying 4,096 levels of density, which we call the Hounsfield units. And you see here the device. The device is a machine that we call a spiral multi-slice CT. Why? Because it's associating two movements. The first move is the move of the table, which is a linear movement. It's combined with a circular movement of the detectors and the X-ray tubes. So this is producing a spiral movement. The technique of angio-CT is to inject a contrast injection in the vessel, to make an acquisition, frequently with 128 detectors. This is producing a lot of slices, almost 1,000 slices, and then we make a reconstruction by direct volume rendering. For this, we use some software like Osiris or Horus, which are free and Mac softwares. You can see the technique. You have a producing of the data by the machine, then it's going to the workstation, and you can, from this workstation, produce movies and animation that you can display on your own laptop. The second principle is how do it works. The volume that you see in the green cube here, the big volume, is made of small voxels, which are very small, 100 micron in diameter. And you see that you can display, you can make a projection on the screen of all these small voxels by an algorithm that we call the ray tracing. This is producing the image. And you can see the power which is needed for that kind of computation. And how does it work, this volume rendering? It's an automatic segmentation because anatomical structures are of different densities. So the computer is making a selection of the scale of density, which we call thresholding. And then we have a table of correspondence between the densities and the colors. And you can also handle saturation, luminosity, and transparency. This is an explanation of the process. You can see on the left a patient, the image of a 3D reconstruction with skin level, and you can see on the top right the densities which are displayed. It is an histogram of density of the same patient. You can see on the left the lower densities and the hair, in the middle the fat and the soft tissues, and on the right the bone and the vessels which are injected, which are the higher densities. And you can see here that at the bottom, you can see that we put a click on the opacity in order to have a display of the skin. If we displace the cursor, which is at the bottom on the right, then we will wipe the lower densities, will make transparent the skin and the fat and the muscles, and we have the image on the left, which are the bones and the vessels, which are the higher density level. Here is an example of a vertical dissection that we can do before a varix surgery. In addition to the skin mapping that you can see on the center, on the leg, we can achieve a CT venography to make a vertical dissection of the patient. And you can see here that you can under the calf, you can move in all direction. You can see the varicose veins. You can also, which is more important, modify the transparency, so you see the varix going through the muscle in the gastrocnemial veins, and you can follow the gastrocnemial veins up. They are ending in the medial aspect of the popliteal vein at the top of the screen. So you can move, you can make a real vertical dissection of this living patient to study anatomy before making an operation. Here we can see on the lateral aspect, you can see the fibula perforators, and we go down to follow the plantar veins and the foot pump. And you can see the fibula perforators at the rear of the fibula. Another example here is a CT scan showing the small vessels and the reticular networks of the lower limb. And you can see also the perforators of the popliteal vein shown in this animation on the right. Also, you can see the same reticular network of the abdominal wall with very small, very tiny vessels shown by this technique, coming from La Plata from my friend Professor Ovela and Juan Merino. Another example here is a young lady who has a left iliac vein thrombosis with a May-Turner syndrome and a post-thrombotic syndrome. Can make a vertical dissection. You can remove the skin and see the epigastric veins. You can see also here the femoral vein. You can see the sump of the iliac. Here we follow the pudendal vein, which is a left to right route of the blood. Here is the re-entry on the right femoral vein. And here also we have a look at the obturator vein that we can follow in the pelvic area. We can remove the bone to better see the volume inside the pelvic area. You can see the ovaric vein and the imprint on the iliac vein of the artery, which is the May-Turner syndrome. Lastly, you can see also the sacral plexus. Another example is with a CT angio is thorax investigation with a virtual reality. Here we enter the pulmonary artery, the trunk. We follow in the right branch of the pulmonary artery, and you can see on the top here a small thrombus. On the left you can see the vena cava, the pulmonary pedicle. Once again, the thrombus in the pulmonary artery. Another kind of investigation is a post-operative investigation after a stent. Here we can see we are in the celiac region. You can see the stent in the aorta. You can see the kidney on the right. Here is the supramesenteric artery. We go down to the bifurcation. You see the iliac bone and the sacrum. Now we can have a trip inside the femoral artery. We enter the right femoral artery. We follow up. You see the calcification inside. We go below the right ureter. You see calcification, and then we have the stent in the iliac and the stent in the aorta. Another beautiful example is a 4D animation of the heart. You see the beating heart, and you see the level of quality of these vessels. You can make a cut, of course, into the cavities, into the atrium, right atrium. You can follow down the aorta, descending aorta. See the lumbar arteries. Another example is the brain with a segmented color image. See the brain vessels, the polygon of Willis. So this is for the volume rendering technique. Now we go to the 3D vectorial reconstruction, which is a second type of modeling. And we saw that
ce que vous devez savoir sur les produits Apple se trouve sur le site web d'Apple.
Now we go to the 2D. Now we go to the 3D vectorial reconstruction, which is second type of modeling. And as we saw before, this technique is using not digital data, but anatomical slices. And it's needed to do a manual segmentation by outlining. Now, let's have a look at our project of research that we did in the University Descartes. The first work was the computer-assisted anatomical dissection technique. It was used for a lot of papers and a lot of topics, as you see here, mainly for quantitative morphology, it was using reconstruction of embryos, human embryos, further carpal bones, the nerves of urethra, the anatomy of pelvic nerves, and different technique of preservation of the nerves, and lastly, the limbs, lower limbs venous system. Another point which is completely different, done by Dr. Olivier Ami, is a virtual birth project. First example, the histological data. You see here that we made a paper about the pulmonary Langerhans cell histiocytosis. You see that it is a characteristic lesion with a granuloma and a cyst of the small branch, which is reconstructed here by different histological slices. You see the scale here, 1.5 millimeter. Other technique is from slices of embryos, and you can see here the modeling of the carpal bones, and you see the millimeter scale. This is making possible a modeling and a quantitative morphology of the morphometry of the carpal bone, and you can see here that we have the dynamics of the evolution of the carpal bone in different size of embryos. And you see that the carpal volume is increasing with the age. And the number of the carpal bone of the first row and the second row are not the same dynamic. You can see that we can have mathematical computation of this. The same project was done for the tarsal geometry also, and you can see a small reconstruction of the tarsal bones. And here you can see that the interest of this is mainly for the analysis of the clot-foot deformity that we made with the team of Compiègne, Professor Obato. Another example of 3D reconstruction of a human embryo is this, a paper that we wrote in SRA. It is a 50 millimeters embryo, which is reconstructed of the pelvic area, and you can see the bladder, you can see all the elements of the pelvis in the embryo. So some words about this technique that we use, which is called the computer-assisted anatomical dissection. It's about embryos and adults, mainly in pelvic reconstruction. Why? Because we are interested by the reconstruction of the hypogastric nerves in the splanchnic nerves and the neurovascular bundles, because there is the most interest in the pelvic surgery for the preservation of the nerves. What is this method? This CEAD method was initiated by Hussel and is the use of immunomarking of the histological slices. So we make very thin slices, we make a block, a series of slices with a block, and each of these blocks have a different staining. We have a reference staining, we can have a trichrome of Masson, and we have 3 different specific staining, one for the nerves, protein S100, you see for cholinergic and adrenergic nerve, and one specific for the vessels, D240. So what do? First, we make a slice alignment. Second, we make a 3D reconstruction by manual segmentation with Windsurf software, and this is producing a 3D model for each anatomical element selected for each kind of staining. Skin, bone, muscle, nerves, cholinergic and adrenergic nerve. And then what happens? So we can gather the different 3D reconstruction elements together to create the whole anatomical model. These elements are not visible on the same slices. The first example is the nerve of the urethra in a male and female, work done by Karam and published in European Urology. You see, it's a fetus of 40 weeks, and you can see that we can identify and separate the adrenergic and the cholinergic fibers, which are colored in yellow and in green. You see, they are located, the myelinated fibers are located at the rear part of the urethra. Another work done by Al-Said is about the pelvic nerves in adults and fetus. And once again, you can see the interest of the technique because we can separate and identify perfectly the adrenergic nerves, colored in green, and the cholinergic nerve, colored in yellow. Another example is the work of Moskowitz, which was published in the Memoir of the Academy of Surgery. And you can see that the interest of this technique is to identify exactly the location of the nerves for the preservation in the rectal surgery for cancer. Lastly, another work from Balaya that we published recently is the same for hysterectomy in cancer. And you can see the corresponding anatomy with the location in an anatomical dissection of the nerves, which once again can be distinguished. So in summary, the surgical interest of this is the preservation of the splanchnic nerves during robotic surgery or surgery of the pelvic, which is the most important complication for prostate, uterus, and rectum surgery. Another different work is about the venous anatomy of the lower limbs in human embryos that we did some years before, using also the CAAD technique. You can see here the immunomarking of the nerves on the left and the immunomarking on the vessels on the right. And you can see, which is interesting, that you cannot see the vessels on the left side and you cannot see at all the nerves on the right side. So it's different staining, identifying different structures. You can see here the sciatic nerve on the left and the femoral nerve. You can see on the right the femoral vein, which is a plexus-shaped vein at this edge, and the big axial veins, which is along the ischiatic nerve. Once again, the femoral vessels, artery and vein. And the result of this is a 3D reconstruction that you can see on the left side, which is the one of a 12 weeks embryo. You can see that we have a big axial vein along the ischiatic nerve. Another example of another embryo with 14 weeks, you can see that all the anatomical elements were reconstructed. You can see in blue here the great saphenous vein. You can see the axial vein with the nerve on the left. You can see the muscles. You can see in purple the small saphenous vein with the sural nerve. And you can see the plantar nerves on the right. So these are the results for the research, but as you can imagine, our main aim is education. And the building of accurate 3D model from slices, coming from visible human, is the most interesting technique to build a virtual dissection table. Some words about the visible human projects. You can see here the main guys who were starting this project. In the center, Professor Ackerman from US, The second is a Korean project from Professor Chung, and then 3 Chinese projects were started. The Korean human data set, as you can see here, is a female which was frozen and embedded with a special liquid. You can see the box. Then the body was cut in small slices. You can see here the cryomacrotome, which is used to do this job, and the Professor Chung in Seoul. This is producing a lot of images, slices of 0.2 millimeters thickness, about 6,000 slices. Then we have to segment these slices and to build the 3D vectorial model. The team of Seoul made a big job to do that. They took 8 years to do that, and they used a technique with Photoshop segmentation, as you can see on the right, staining with Photoshop all the slices, and then making a reconstruction with special softwares. For our project, we did a different technique because we make a direct outlining on the slices by manual segmentation using a special software which is Windsurf. Very simple, but very nice software. You can see here the example of manual segmentation of the bladder on a slice. So what do we do? We make a lot of these slices. Then you have a mesh. You can make a mesh joining the different slices. You can do the same for the hepatic veins. For this, you need to use a lot of channels because you have a lot of branches. And the result of this are displayed here. And you can have the liver, you can have the biliary tract, and you can have the segmentation of the liver. And you can see here. So this is an example of animation that we have. When this finished, you can see that the liver is in transparency. The portal system is in purple. The hepatic vein in blue, and the biliary tract in green. So you can see that we can handle all this 3D model. You can see the hepatic veins. You can also modify and add the segmentation. You see the color segmentation of the liver that you can handle also. This is a very nice tool to learn hepatic segmentation. You can have also the names of the segments. Segment 2, 3 on the right, 4A, 4B, and then on the right liver, from the rear, from the anterior to the rear, 5, 6, 7, 8. Go back to the vessel here. Another important feature is you can make a slice in the sagittal plane of the model. So you can cut the liver in any plan, mostly the sagittal plane here. Can modify the slice, the cut. This is the feature produced by 3D PDF model. Another way to display is a ray tracing of the liver with the segment. Is a tool that we use. It's a virtual dissection table using a huge touch screen, which is manipulable only with 3 fingers. And you can see that you can manipulate the model on the screen directly, and you have a lot of buttons to display different parts of the body. This is an example of what to do with virtual dissection table. You can use select a part of the body with the buttons, upper limb, lower limb. You can use also and select a system. This is a urinary system. This is a genital system. You can see that we can display a slice inside the model. This is a digestive tract, pulmonary system, the heart and the vessels, the brain, the hand, the foot, and also we can display several slices that we can manipulate, and we can add inside the slices different kind of elements. In this case, we add the arteries. You can see the arteries, 3D vectorial model superimposed with the slices. You can add the veins, can add the nerves, and finally, you can also, if you click, you can have the name of the element which is displayed in 3 languages. You can make this, you can remove the skull, you can handle any element. If you click, this is in French, rein gauche, and the name could be displayed, left kidney, in Latin, in Spanish. So, another example is a rotational animation of the heart and the vessels. We see here another example with head and neck vessels. You can remove a part of the skull. You can handle any part. In overall, there's 1,500 pieces. You can remove completely the skull, remaining some muscles. You can see the brain. Removing the muscles. You can see the polygon of Willis. This is a zoom of the brain. But you can remove a part of the brain to see inside and to see the thalamus and the ventricles. Is a longitudinal, super longitudinal sinus. See the thalamus. Another possibility also is to display the different slices along the model. This is a model of the arteries and the slices displayed down. You can also do the same with the veins, portal system and caval system. And finally, with the nerves. Similarly to this human atlas, a very nice work is the Human Atlas of Embryology, which was produced by the University of Amsterdam, by the Professor De Backer it was using the same methodology as ours, that is embryo from Carnegie at all stage, histological slices, segmentation, reconstruction, vectorial reconstruction, and interface Acrobat 3D PDF interface. This is the methodology used by this work. You see the specimens, you see the software, Amira, for digitalization and alignment, and then annotation, reconstruction, and 3D reconstruction. It is a fantastic biblioteca of embryology. You see that you have all the stages are represented. And here, there is a demonstration with a specimen of 2 months. You see that you can move the embryo. Here, the skin is in transparency. You can select a system. This is the cardiovascular system, umbilical vein, common cardinal vein, anterior superior cardinal vein. You can select alimentary system with the liver, esophagus, the skeleton. Can manipulate and make transparent different elements. Urogenital system, the gonad, the bladder, and the metanephros. Lung, and finally, the nervous system. The size of this is 16 millimeters. There are also other tools for education and for anatomy learning, which are animated vectorial models, the movie that we can produce from volume rendering techniques, the photogrammetry, the 3D printing, and the immersive reality. We have a look at those different tools. First of all, example of a VRT from an angiosity, which is a journey inside the pelvic area. So here we see the femoral vein. We follow here the obturator vein in the obturator hole. We discover on the left the hypogastric vein with the branches, sacral branches on the left, gluteal branches, and obturator vein joining the obturator hole in the pelvic area. This patient had pseudo-May Turner syndrome. You can see on the top the imprint of the artery on the vena cava. And if we modify transparency, we can see the artery and the imprint of the vein. So photogrammetry is another technique to learn and to teach anatomy. And the principle is to build from several rotational photographs a 3D vectorial model. Here is an example, a software which is called 123D Catch is producing these kind of models. And you can see here that you can move the model. This is a dissection. You can put labels. And you can have some manipulation of the dissection. You can see here the aorta, the kidneys, and the colon. All these techniques are used now for surgery, and this is a very important point. The EarCAD company in Strasbourg produced software which is a visible patient, VP patient, and you can see that you send your scanner, your CT scan angio, to this company, and they make for you the 3D reconstruction. And this is before an operation to make a planning or to make to have a good idea of the anatomy. Another technique is the 3D printing, and you can see here an example of a collection of our collection of the popliteal fossa variation, and you can buy these models, which are very useful for learning anatomy for the young. Another interesting application of this 3D model, realistic 3D modeling, are that kind of body parts that could be very useful for surgeons or anesthesiologists for training. This is, you see, done by the company Biomodex in France. Another interesting technique is plastination. Plastination, you can see the catalog, which is a Chinese catalog here, producing a lot of pieces. It's silicone injection in the tissues. It's a very long and difficult technique, but it produces very nice results, which are real anatomy, very nice for teaching and learning, but very expensive also. Lastly, we saw the new technologies, immersive reality with the Oculus mask. And the most important point is that it's a powerful educational tool because it's using emotional facts. Another use of virtual reality from Basel.
Data sets using volume rendering. And they can walk around, they can grab the object, reposition it, they can also change the size, zoom in.
Manipulation of a 3D model from rendering.
So that they have the most comfortable and best view of the scene.
Manipulate with a tool.
As an additional option, we also gave them a cutting plane. This cutting plane can be used to either cut through the volumetric data set, to, for example, cut open the skull or the rib cage for a better view of the scene.
Other example? Holograms? And finally, virtual art from HoloLens, 4D reconstruction.
Okay, so you can kind of look at this ginormous heart and look into the function of it by cutting into one of the chambers and actually looking at a valve and how they operate. Probably a view that would be very difficult to do without something like this. So you can do other things like rotate it, rotate.
Voice command.
Spin it around.
Hand command.
Stop.
We have finished. In conclusion, as you can see, 3D modeling is interesting for research. but it's mostly a revolution in the technology for educational tools, and this is the new educational tools of the 21st century, and the use for today and the future is for surgery, because these same tools can optimize the surgery by 3D modeling. It's making possible a pre-op planning, a simulation, and the use of augmented reality during surgery. Thank you very much for your attention.